There are two methods for giving pills and capsules to cats: the finger method and the pill gun method. The finger method is the easiest for beginners to learn, although the pill gun method is a good choice for cats that bite, since you can medicate the cat without putting your fingers into her mouth. Hiding medications in food is a trick that works well on many dogs. Unfortunately, most cats are delicate eaters and will usually eat around the medication. If your cat is a hearty eater, give it a try. Hide the pill in some soft food, like a piece of cheese or a hot dog, or press it into a soft treat. But if your cat is like most cats, you'll have to give the medication directly. Find a good work area to medicate your cat. We recommend using an elevated, slippery surface, such as a tabletop or the top of your washer or dryer. Slippery surfaces make it difficult for your cat to escape. Get out everything you'll need: the medication, a towel, and a treat for afterwards. Once you've caught your cat, you'll want everything within easy reach so you can work quickly. Finally, ask a friend or family member to help hold your cat. With practice, you may be able to medicate your cat on your own, but at first, you'll find it easier to have someone to help. Place your cat on the table. Have your helper restrain your cat by holding her from behind with one arm on either side of the cat, grasping the elbows of each front limb and pulling the cat in. This cradled position makes it difficult for your cat to escape. Take the towel and wrap it around your cat's neck and front legs like a shawl. This will help to prevent you from being scratched. To make the pill or capsule easier to swallow, try coating it in some butter. If you're right-handed, begin by grasping the pill or capsule between your thumb and forefinger. You will be using your middle finger to open the cat's mouth all the way. Grasp her head with your left hand, tilt her head back and open her mouth. With the mouth fully open, insert the medication into your cat's mouth in one quick motion. Put the medication on the center of the tongue and quickly push it as far back on the tongue as possible. Remove your fingers and close your cat's mouth. Hold the mouth closed until you see your cat swallow. You can stimulate swallowing by blowing on your cat's nose or massaging her nose or throat area. Watch for licking or signs of movement in the throat area, both signs your cat has swallowed the medication. Once your cat has swallowed, release your hold on the mouth, but keep watching for a minute to be sure she doesn't spit out the medication. To make sure the pill or capsule isn't stuck on the way to the stomach, immediately give your cat some tasty food to eat, something she really likes. Or ask your veterinarian for a small syringe so you can gently squirt a little water into your cat's mouth after you've given the medicine. 2 doses of about 1 milliliter each will do the trick. To make the pill or capsule easier to swallow, try coating it in some butter. Load the medication into the rubber tip of the pill gun. Restrain your cat and tilt her head back so her mouth begins to open. Insert the pill gun into the mouth, positioning the tip on the center of the tongue as far back on the tongue as possible. Depress the plunger to deposit the medication. Pull the pill gun out and immediately close your cat's mouth. Once you see your cat swallow, release your hold on the mouth and watch for a minute to make sure that she really swallowed the pill. To make sure the pill or capsule isn't stuck on the way to the stomach, immediately give your cat some tasty food to eat, something she really likes. Or ask your veterinarian for a small syringe so you can gently squirt a little water into your cat's mouth after you've given the medicine. 2 doses of about 1 milliliter each will do the trick. Keep the sessions as short as possible. Most cats dislike being restrained more than they dislike the actual medication itself. Working quickly goes a long way to ensuring success. Remember to reward your cat afterwards with her favorite treat or toy. Positive reinforcement will make it easier the next time you need to give the medication. And while your cat is on the medication, remember to give extra loving attention. Focusing positive attention on your cat during other parts of the day will make her less fearful and suspicious of you. To medicate your cat alone, try using a corner of the room. Position your cat's hind end in the corner and kneel down in front of her to prevent escape. Grasp her head over the ears and give her the medication. Try associating the medication session with your cat's favorite food treat. When your cat shows up, simply close her into a small room where it's hard for her to hide. Be careful, however, to avoid associating medication with your cat's regular mealtime. Some cats may stop eating if they begin to associate meals with unpleasant experiences. A similar problem can happen if cats are captured and medicated while attempting to use the litter box. Such food and litter box aversions can become quite a problem and are best avoided. If scratching's a problem, try clipping your cat's nails. For cats that are really difficult to hold, you can try wrapping a towel completely around your cat. Although this can be very effective, some cats intensely dislike it, making it harder to medicate them the next time. No matter how perfect your technique, some cats are impossible to medicate safely. If you're having problems, talk to your veterinarian about pill and capsule alternatives such as liquid, injectable, or transdermal medications. First, make certain you are placing the medication properly on the back of the tongue. If the medication is too close to the tip of the tongue, your cat can easily spit it out. If you're using the finger method, you may want to experiment with the pill gun method, which allows you to position the medication further back on the tongue. If positioning is not the problem, try coating the medication in a little butter. The slippery butter coating facilitates swallowing. Or you can coat the medication in a little peanut butter. This sticky coating makes it more difficult for your cat to spit out the medication. Foaming at the mouth after giving pills or capsules is not a cause for alarm. Some medications leave a bitter aftertaste, causing your cat to salivate. Coating the pill in peanut butter may help to disguise the bitter taste and eliminate the excessive salivation.